When we think of gum disease, we usually picture aging adults. It's easy to assume a child's brand new smile is completely immune to decay, but kids face their own distinct threat. While their teeth might look perfectly fine on the outside, a bacterial infection can quietly take hold inside the soft tissue of their gums. The primary threat to a child's oral health is the unchecked passage of time. If we only focus on scrubbing the surface of the tooth to prevent a cavity, we ignore the gums, the structural foundation holding those teeth in place. And that foundation is highly vulnerable to a biological clock that starts ticking every single day. The countdown begins the exact moment a child finishes a meal. Within seconds of eating, microscopic food particles wedge themselves firmly into the porous surface of the enamel, acting as a biological anchor. To understand how fast this environment degrades, we are going to track the timeline of a single skipped brushing session. From the instant those initial food particles stick, a compounding chain reaction kicks off. If it isn't interrupted, this process will eventually compromise the tooth's entire support system. Between 2 and 4 hours after a meal, an invisible bacterial film rapidly spreads across the teeth. This timeline shows a thin layer forming against the tooth. This is plaque. By day 4, it thickens, resisting the mouth's ability to shed waste. The real danger arrives at 2 weeks. The soft film crystallizes and expands downward along the root. This hardened substance is known as tartar or calculus. It is a rigid, stone-like deposit, structurally similar to a kidney stone, and the body has no natural mechanism to fight it off. Once formed, this jagged tartar acts like a suit of armor. It traps fresh, sticky plaque permanently against a gum tissue, triggering a localized bacterial infection. Time is the primary weapon here. Over 14 days, a soft film matures into a permanent, calcified fortress that actively attacks the child's gums. This 14-day timeline isn't universal. For many children, unseen variables accelerate the clock. Inherited genetic traits play a role, as do the physical shapes of the teeth. Irregular gaps create protected safe havens where food easily gets lodged and bacteria can multiply undisturbed. The body's internal chemistry matters as well. A lack of proper nutrition, hormonal shifts, and underlying systemic conditions like diabetes all weaken the immune system's defensive response to bacteria. One of the most common yet overlooked risk factors is chronic mouth breathing. Breathing heavily through the mouth continuously evaporates saliva. This physically strips away the mouth's natural moisture layer, creating a dry environment where plaque thrives. Together, these structural and systemic multipliers act as accelerants, compressing the timeline and turning standard plaque buildup into a rapid, severe infection. When the infection takes hold, the physical warning signs emerge. The gum tissue turns deep red, swells in size, and begins emitting a chronic, mild ache. For most parents, the first undeniable signal is blood. Simply pressing a toothbrush against the inflamed tissue causes it to bleed instantly. Without intervention, structural decay sets in. The gum line physically recedes, pulling away from the root, which visibly widens the gaps between the teeth. In the most extreme cases, the trapped infection generates chronic bad breath and actively pools pus into the pockets between the gum and the tooth. These alarming symptoms are not random injuries. They are the inevitable final stage of a biological clock that was allowed to run its course. Once the 2-week mark is breached and tartar sets in, the window for at-home prevention closes. A standard toothbrush simply cannot penetrate the calcified armor. The immediate clinical response requires a professional dental cleaning. A dentist must use specialized tools to physically fracture and scrape away the tartar deposits. If the infection has spread deeper, a deep cleaning procedure is required to manually scrub the root surfaces below the gum line. In worst-case scenarios, doctors must prescribe These severe, invasive clinical procedures are the strict physical toll exacted for failing to stop the plaque clock early on. While this biological timeline is intimidating, it is remarkably easy to disrupt. You have the power to reset this clock completely at home. The primary defense is simple mechanical disruption. This means brushing twice a day using an age-appropriate brush and fluoridated toothpaste. But brushing isn't enough on its own. Daily flossing is an absolute necessity to physically clear out the narrow gaps where bacteria hide, safely out of reach of the bristles. You can support this by having your child aggressively rinse after every meal. prioritize nutritious, low-sugar foods, and schedule regular dental checkups. Pediatric gum disease relies on an uninterrupted timeline. By proactively breaking this biological clock every single day, parents can protect the structural integrity of their child's smile for life.